Finances webinar, and today we're going to be talking about a variety of different topics, but all circulating around the topic of healthcare, especially healthcare and retirement. And we're going to give you some definitions, which may be a little review, but it's always good to have a review. And then we're going to talk about some strategies to how to pay for healthcare, because that's really where healthcare and finances intersect, right? How do you pay for the care that you need? So I'm very excited to be doing this presentation. If we move on to the next slide, you'll see a nice picture of me, beardless. But I'm a financial advisor with Stein Financial Group. You see our address located there. By the way, we just moved. So if you want an excuse to come see us, to see our new office, we'd love to have you in. It's a great space and we're very excited about it. You can see our number there. That is our main office number, and I am extension personally 104, but we have a number of different members on the team. There's a whole menu you can go through, and we're aiming to provide the same response times and callbacks and pick up the phone. Actually, we'll do that for you as we always have. So just a quick reminder about who I am and where we're coming from. So now let's get started. Slide 3. Why are we here? Okay, even taking a step back, I think it's sort of self-explanatory why healthcare is important, right? I mean, what else could be more important? But let's even take a step back, because what we want to help you do is to live well, live the good life is kind of our slogan. And why should you worry about healthcare and retirement? Think of it this way. You are likely to be retired for 20 or more years, just statistically. Based on the average American. And it's likely that you'll need some type of healthcare beyond just your regular checkups in that time period. And I hope it's very minor or non-existent for all of you, but we all know someone in our family or friends who's needed a higher level of healthcare, and we need to prepare just in case we do too. So even if you're really healthy, you will be aging. I hate to break it to you. You may get sick, you may have an accident. The time to prepare for those things is now, before they happen. When you have a solid plan in place, you'll have one less thing to worry about during your retirement years, and that'll give you the freedom to get more enjoyment out of your retirement, to do the things you want to be doing and not worry about what if this and what if that. So that's kind of our aim here, is to help set you up in that realm. If we move on to the next slide here, we're going to talk about retirement healthcare costs. And for a 65-year-old male, you are likely to live to age 84.1. Okay, we'll call it 84. You're likely to live to 84 if you've already made it to 65. Now, you hear about those average life expectancies, and usually they're in the high 70s or low 80s. Well, it's different if you're already at age 65, right? You've already made it the first 65 years. Your life expectancy goes up if you've made it that far versus the average person, indiscriminate of age. And women, this is no surprise, tend to live longer than men. So if you're a 65-year-old female, you're likely to live to 86.6 years old. And you can see the difference in dollars, and those are averages, and that's not going to be true for any one of you. But over an aggregate, those are about the cost: $135,000, $150,000. And by the way, these predictions, these numbers are coming from the Social Security Administration. So if you retire at 65, you will likely spend about 20% of your life in retirement. That's how we're getting that number that I mentioned on the previous page here. Planning ahead now can mean these years are financially more comfortable. So if we just look at healthcare, those $135,000 and $150,000 numbers, that comes from a 2019 Fidelity study. So those are pretty recent numbers. And I don't know about you, but I only expect healthcare costs to increase over time. So that may be a backward-looking number, but going forward, it may end up being even more. Just to give you a sense of what's included, and we're going to talk about all these different things in a little bit more detail as we move along. It includes the costs of Medicare, Medicare Part D, Medicare Part B, and out-of-pocket costs, in-home health care, or other services that many people require as they age. Now, we're going to go through all the parts of Medicare. We're going to talk about healthcare, in-home, nursing home, assisted living, all the differences there. But that number, that dollar figure, is kind of a total of those on average. So it's a big number. And how we pay for it, again, the intersection of healthcare and finance, is kind of what we're here talking about. So next page goes to a did you know? All right, did you know 1 in 3 people will require nursing home care at some point in their lifetime? And in fact, that's people turning 65, 1 in 3. So, but of that 33%, or of those 1 in 3 people, 6 in 10 will require, or excuse me, nursing home residents are covered by Medicaid. And so Medicaid is an aspect of Medicare, but that is an important piece here because, as you may know, Medicaid helps people who are, maybe have exhausted their resources paying for their health care. So there's a lot of people right now who are on government assistance in a nursing home, and that's not necessarily a bad thing. I mean, we want to talk about how to maximize your assets and then get the most out of the benefits that are offered to you, Medicaid being one of those. But at the same time, we can't just use it as a get out of jail free card because that doesn't set us up for success. We want to use it smartly, wisely, but not to the extent that we neglect planning in the near term. I'm sure you knew I would say that. We always want to plan in the near term. So next page talks about how to prepare. So there's 3 legs of the stool here that we're going to cover today. One is long-term care service. So we're going to talk about exactly what those services are, and it can range from in-home care to nursing home care and anywhere in between. We're going to talk about advanced directives, and by that I'm really talking about wills, especially care directives. What do you want? Do you want to be the one controlling that ahead of time? Who is going to make the decisions for you if something should happen? Those are very important pieces. And finally, and maybe most importantly, although these are all very important, paying for the healthcare. That's a big deal. Next page, we're going to start at the top, long-term care services. So I mentioned it before, nursing homes, assisted living facilities, and continuing care services. And actually, this is one of those that's less known about. I think it goes into detail in a page or two. But the idea there is there's retirement communities, and you don't necessarily have to think of the Florida communities with cookie cutter houses all next to each other, but communities that maybe offer some level of medical service, not even to the extent of an assisted living, but they often require a sort of commitment that you're going to live there. It's so-called retiree communities. And there's different flavors and versions of that, and what's going to be right for you depends on you. But those 3 are 3 primary, and then there's one that's not on here, which is nursing homes is number 1, assisted living facilities number 2, continuing care retirement communities, which is kind of the technical name for what I just described, number 3, and finally home health care services, which is really the most popular now. Maybe not by usage, but by desire, right? Everybody wants that home health care, or most people do, if they can swing it. And that's really the big key. Can you swing it? Well, number 1, it's going to depend on your health situation. But number 2, it's going to depend on what's in the bank, or what do we have set up to pay for that person to come into your home rather than you going to a facility. So understanding each of those types is going to help you prepare quite a bit. Let's go to the next page here where we'll dive in on nursing homes. So I think a lot of you know what a nursing home is. I'm not going to spend too much time on this, but just to level set about what I'm talking about when I say a nursing home. I'm talking about daily physician care, I'm talking about a physician on call, registered nurses on site, aides for everyday activities. I mean, this is your highest level of care. You're in a facility with trained medical professionals. You're getting care on a daily basis. Enough said. You know what a nursing home is. Next page talks about assisted living. And there's a little bit of wiggle room on the definition of assisted living, but in general, they're live-in facilities. That's kind of the mandatory part. There's a little medical care. So you can call it little, as in not a lot, or a little, which is maybe the unintrusive way of saying it, right? So there's a little bit of medical care, and there's some assistance with daily activities, but it's not to the same extent as the nursing home. There's a little bit more autonomy there, maybe is one way to put it. And, the accommodations and services greatly depend on the type of facility and, how much we're willing to cough up here. That's just the reality. But there's usually daily activities, daily meals, exercise activities, health services, wellness programs, transportation arrangements, educational activities, and most of those are optional, but you know what I'm talking about. Third, okay, this is and this is on the next slide, continuing care retirement community. That's, again, the technical name. and they're a lesser known option, or at least a lesser understood option maybe. They range in services from independent living to nursing home, so there's a lot of wiggle room here. They may require a lifetime commitment. So I alluded to this earlier. That's one of the interesting things here, where you say, yep, I am living here for the rest of my life. They may require that for when you're allowed to move in there. So uh, with that said, it's very important if you do look at these, or if you're thinking about moving into one, that we really talk about this with a lawyer and an accountant before we sign a lifetime commitment, right? I think that's self-explanatory as to why we want to do that. But if we're doing something for life, we got to be darn sure it's the right decision. And that's the key. So just to give you a little background, by providing a range of services and living situations based on a resident's changing needs over time, the CCRC, as it's called, Continuing Care Retirement Community, is really best suited for someone who want the security of being cared for in the same community throughout the aging process. So as you may move from more of a, well, I'm fine with home health care, and then maybe over time you need to go into assisted living facility, and then maybe at the further along, a nursing home is really what you're going to need. Well, these retirement communities maybe have all three of those options, and you just kind of shuffle throughout the community. It's a benefit for stability. The downside is, again, you may have to commit for your full retirement or for whenever you move in until we pass on. So it's something to consider. It's a lesser known option, and if nothing else, it's an FYI. Finally, home health care. So receive care in your home. Now, obviously, services may include medical, grooming, meal prep, housekeeping, may help you stay in your home longer. That's obviously the number one reason to do it. And home health care has gotten only more sophisticated as time has gone on. There really are a great amount of options. And yes, you've got to find someone who you can work with both personally and whatever service provider is providing it. Find something that works for you. But it's a great option, and it's something that's being covered by a lot more different types of insurance, whether that's long-term care insurance, or we can even talk about other ways to help pay for this sort of thing. So going forward to the advanced directives slide here, we've got living will, and this is maybe the most important. These both are very important, but the living will is huge because it states your wishes for future medical care. And this is about who's making the decisions. And I'm not even saying that you should do this, because I definitely recommend that everyone at least thinks about doing this. But I'm not saying you should do this just because you have a specific set of rules you want followed. It's a good thing to do this to take the burden off somebody else, usually. And, we all have trusted people in our lives, hopefully, who could make decisions for us if the time came. But it's good to sort of make it easier for them by sort of laying out what you want ahead of time. It saves a lot of heartache or anguish about what's the right decision, what would they have wanted. Let's get it in writing now so they know exactly what you would have wanted. So to give a little bit more clarity on that, that's my flavor at the top. Advanced directives, and that's both of these, living will and medical power of attorney, are a way to have your say about the type of care you receive or don't receive in the event you suffer a catastrophic medical event. And it doesn't even have to be catastrophic. It can be something that tells you, or something that just causes someone else to have to make a decision. That's usually that catastrophic event, but it doesn't have to be. A stroke or an accident, for example, would be two examples of that. There are two main types of advanced directives: living wills and medical power of attorney. A living will states your preferences regarding the type of medical care you want to receive or don't want to receive if you're incapacitated and cannot communicate. So if you are not capable of making the decision yourself, this document will say what you want. You specify the treatment you want to receive or not in different scenarios. So you can play it out. It's not a one size fits all. You can say, if this happens, I want this. If this happens, I want that. Also known, and I'm going on to the medical power of attorney here, you may have heard durable power of attorney for healthcare or healthcare proxy. Those are sort of interchangeable for this medical power of attorney. A medical power of attorney names another person, usually a spouse or a child, doesn't have to be, but usually, to make medical decisions for you if you are no longer able to make them for yourself or you are unable to communicate your preferences. So similar concept, it's just instead of going to what you've written down, you're saying this person is allowed to make the decisions for me. And by the way, these are not mutually exclusive. You can have both and oftentimes should have both. Note that a medical power of attorney is not the same as a regular power of attorney or just power of attorney, which gives another person the authority to act on your behalf on matters you specify, such as handling your financial affairs. So there is a difference between medical power of attorney and regular power of attorney. Just something to keep in mind. Probably both are worth investigating at some point. The next page still talks about advanced directives. Laws may vary by state, obviously, right? Depending on what state you live in, you're going to want to find a legal professional from your area because they're the ones who are going to know the local laws the best. But the question is, how do you prepare an advanced directive? And there's some good bullet points here I'll go through in a second. But since the laws differ from state to state, you're going to want to find an attorney who, as I said, really knows your state law. It is possible to create advanced directives in multiple states. So if you split your time, even if you're saying, well, I'm a resident of Minnesota or I'm a resident of Florida and I come to Minnesota in the summers, let's say, you may say, well, I'll just do it in Florida and I'll be fine. Well, what happens if something happens while you're up in Minnesota? You want one in every location you're going. Now, you don't have to do one every time you go on vacation necessarily, but if you spend a significant amount of time in one or two places, it's probably a good idea to have that on file at both places. And again, you want to get that sorted out for the individual state laws. That's a big piece of this. And just as my disclaimer right now, should have mentioned at the top, we are not attorneys. So we can point you to some great people and some great partners who can help with this, but this is not something that I do or that our office does. We can refer you to some great professionals who can help with this though. Give current okay, make sure the person you choose to act on your behalf has current copies, because they're not just going to trust that whoever walks into the hospital for you is the right person. They're going to need to see the proof. So make sure that that person has a copy or at least knows where one is and it's accessible. It's not in a safe they don't know the combination to. It's not in a safety deposit box in which the key has been lost for 5 years, right? They have the documents or they can easily access them. And make sure also your doctor and your long-term care facility, if that applies to you, have a current copy as well. It's just going to make things way smoother. And if any of you have dealt with this with a parent or a loved one or anyone, you know how complicated it can be sometimes. So it's nice to just have that all set up so it's smooth for the people who want to take care of you. On the next page, we're talking about paying for healthcare and retirement. So we've got retiree health plans, Medicare insurance program, Medicare and Medigap insurance, Medicaid. Okay, Medicare, Medicaid, Medigap. Oh boy, we've got a lot to untangle here, right? Long-term care insurance. And finally, personal savings. And this is something that I say often. Your investments, the one way to look at them is they're actually insurance. And like life insurance is insurance for what happens if I, quote unquote, die too soon, right? If I leave people who need me, who depend on my resources for their sustainability, what happens if I go away too soon? Well, your investments, one way to look at them is they're kind of your insurance for if you live too long, quote unquote, right? Too long, what does that mean? But if you don't want to outlive your money, and that's what your investments are for, to try to prevent that as best as possible. So my 2 cents on top here. But a part of a healthcare plan, a big part of it, is how you're going to pay for it. It'd be nice to believe that healthcare cost increases were a temporary phenomenon, confined to a certain decade or two, but unfortunately that's not the case. The cost of medical care has outpaced normal inflation for the past 20 years, and predictions are that medical and long-term care costs may continue to escalate as much as 10 or 15% into the future. So the decisions we make as to how and where we live in retirement, and the where is big too, are unique to each individual or couple. The options open to us, however, are frequently determined by our financial resources. Are you going to get into the facility that you want to get into? That's often a financial question just as much as a care question. This review of the various ways to pay for health and long-term care costs during retirement is offered in the hope that it will be of assistance to you as you make decisions. So I'm going to go through each of these pieces here. So I've already listed them, and I think, yes, we're going to go through each one individually. So the next slide talks about retiree healthcare plans. So this may not be available for you. It really depends on where you worked and what the benefits were. But a retiree healthcare plan are available to places that offer them through your pre-retirement employer. So retiree health insurance plans are generally designed to coordinate with Medicare benefits. If your company provides retiree healthcare benefits, make sure you know how much of the premium you will be required to pay, as well as deductible and co-payment requirements. So to back up, this is insurance you can get from your former employer once you're retired. I'm not talking about while you're working. I'm talking about once you've retired. There are plans out there from employers that offer in-retirement healthcare plans. Now you're paying for it. So the cost here is a question, right? Is it cost effective or not? That depends on you and the plan and your situation and the plan situation, all that stuff. But it may be an option, and it's definitely something to consider. If you aren't sure if this type of plan is available to you, you may want to meet with your HR or review your employer's health insurance program to understand what healthcare benefits may be available to you after retirement. So if you're still working, definitely something to get on top of. If you've already retired, you may have already gotten to the point where you would have been informed of that. But if you've retired and you're wondering, hey, how can I change my healthcare or how can I manage it better? It does depend on the plan, how you might get it set up, if you had to elect it right away or not. But it's something to file away at the very least as an FYI. A downfall, however, of retiree healthcare plans is that companies have the right each year to increase healthcare premiums and or co-payments and deductibles paid by the retirees. So it can be a good option, but can also be an expensive option. So it's really one of those things that comes on a case-by-case basis. That's kind of my 2 cents on those. All right, next page, we get to our bread and butter here, Medicare insurance program. All right, quick quiz. Medicare's A, B, C, and D. Cover your screen. Do you know what they all are? Well, it's a little complicated. They've tried to make it a little simpler, but it can be complicated. All right, Part A. Part A is often known as hospital insurance, and it's quote unquote free if you or a spouse paid Medicare taxes throughout your working years. That's not really free, is it, if you paid for it throughout your whole life? But you get it as part of your repayment for paying in all those taxes during your working years. Maybe that's the more politically correct way to put it. But that's the one that you get. You've paid for that already, just like Social Security. That one's coming to you, and you do not have to, sign up extra for it. That's the generic, regular Medicare. By the way, what does it cover? Well, hospital insurance tells you a little bit, but it covers some of the costs of inpatient hospital care and, on a very limited basis, pays for care in a skilled nursing facility or through home health care. Very limited basis. This is not a good way to fund your nursing home expenses. It doesn't work that well for it. It can pay for some of that stuff in certain circumstances. And if you want to know what all those circumstances are, I'd have to do another hour to go through all the technicalities there. It's easier just to call us and we can talk about, exactly what makes sense for you. But just something to know there. Part B is sort of the closest thing to your regular health insurance that you had while you were working all those years. Doctor services and outpatient hospital care. This is going to cover your checkups. This is going to cover any outpatient procedures you have to do. Anything where you don't spend a night, you go into a clinic, you get a scan, whatever it is, that's what's covered under Part B. And it's similar to most employer-based insurance plans. That's kind of how you think of it. You must sign up for Part B and pay the monthly premium, which is usually just deducted right from your Social Security check. In 2020, the standard Part B Medicare premium is $144.60 per month, so $144.60 per month. This amount increases for those with higher incomes. In 2020, individuals with incomes over $87,000, and that's individuals, and married couples filing jointly with incomes over $174,000, double that 87, pay a higher Part B monthly premium of $202 a month, $2.40. By the way, this is where you hear that 2-year look back. So the government doesn't make you pay based on what they expect you to earn in 2021, because obviously you have to pay in 2021 for your Medicare in 2021. They're going to look back 2 years as to what your income was. So it can fluctuate. Let's say you have a high income year. You retire, for example, and then 2 years later, that last year where you maybe earned your highest salary, that's going to get reflected in those Medicare Part B premiums. Just something to keep in mind. Part C is known as a Medicare Advantage plan, and this provides the benefits through a private insurer. So we're not the government now. Private insurer is designed to replace Parts A and B. So Part C is kind of an amalgamation of A and B, a combination where you're maybe getting a higher level of benefit, or you're getting something that's a little more tailored to you than sort of the generic programs. And by the way, Part B also has different programs available. You can, kind of like with your work employer, you can do a higher deductible and a lower premium. Well, the premium's different, but you can choose a higher deductible. There's a little wiggle room there. There are various types of Medicare Advantage plans, which, in addition to providing the hospital and doctor benefits of Part A and B, may offer additional benefits. The premium for these plans is generally less expensive than the Medicare Part B premium, plus the cost of Medigap insurance, which I'm going to talk about in a second. Again, Medicare, Medigap, Medicaid. Hopefully I can untangle all this in a reasonably understandable way. But there are also plan network, co-payment, and deductible requirements to take into account. So again, no easy answers here. Whether Part C is a good option for you really depends on what you're looking for. And we can help kind of talk about that, but I can't give a one-size-fits-all answer. All right, Part D, easiest one to remember, I think, D for drugs. Part D is the newest one, by the way, going back just a couple of decades here to the early 2000s. And it's the Medicare's prescription drug plan. This plan is available for an additional monthly premium through companies that contract with Medicare. So if you have Medicare Parts A and B, you can purchase Part D. Or you can purchase a Medicare Advantage plan, again, that would be Part C, with the prescription drug benefit under Part C of Medicare. So and I know I'm going Part A, Part D, but basically Part D is your drugs. You can get it whether you just do the A and B or whether you add on the C as well. And again, the C is totally optional. That's just sort of, it has additional benefits to it. Important, Part D is designed to pay some, but not all of your prescription drug costs. So it's not going to cover everything, just like no insurance is going to cover everything, right? You're going to pay something for it, but it can help a lot. And often, in many cases, I'll say, it is a good idea. All right, next slide talks about Medicare and Medigap insurance. So Medicare still has out-of-pocket costs, unfortunately, right? I wish we could say, hey, you paid in all those years, healthcare's on us for your retirement, but we know that's just not how it works. People enrolled in Medicare Part A and B find that even though a lot of their medical care is covered, they could still face considerable out-of-pocket costs. In order to pay the costs not covered by Medicare, many people elect to purchase a Medicare supplement plan from a private insurer, Medicare supplement plan from a private insurer, important, to fill in the gaps of Medicare Part A and B coverage. You see where I'm going with this. A Medicare supplement plan is Medigap. Medigap is just a term that was used to describe a policy that you add on to A and B from a private insurer that will fill in any gaps or some of the gaps of Part A and B. So Medigap plans or Medicare supplement plans, and those words, think of them interchangeably, they can be fairly expensive, but they can limit a lot of your out-of-pocket costs. So whether that makes sense for you, obviously the wheels are already turning, I know. Can I afford it is a big question. Do I need it is a big question. Everybody's going to have a slightly different combination of answers there. So that's, again, something we need to talk about. Medicaid is the next piece here, and that's on the next slide. All right, Medicaid is a joint federal and state program that helps with medical costs for some people with low incomes and limited assets. Medicaid programs vary from state to state, but most healthcare costs are covered for those who qualify for both Medicare and Medicaid. So homes and cars do not determine your eligibility for Medicaid. That's a little bit of a misnomer out there. And they may be subject to a state recovery law. So let me take a quick step back. First off, Medicaid is 100% a viable strategy in retirement for how do we pay for things. It's something that we need to take into account. I think there's a lot of thought out there that Medicaid is for people who don't have enough money or can't take care of themselves or things like that. And yes, it is for working age people, but for retirees, it can be a very valuable tool, and it is a benefit that we all pay in for with our taxes. So we need to take into account how we might be able to benefit from it. Now, another topic, and those last 2 bullet points kind of address it a little bit, is often I will get the question, is it okay if I sign over all my assets to my kids? Can I just go on government benefits and live the rest of my life on Uncle Sam's dime? And functional, if you really want to get into it, you can do that, and it will, affect how your Medicaid gets transferred to you or not. It's way more complicated. I'm not going to go into all the details there, but it often doesn't quite work out the way you'd think. Is my caution whenever I hear that question. So my answer to that question for right now is we really need to have a very in-depth conversation about what that would look like if that's on your mind. And I'm more than happy to have it, but on an individual basis. I know a lot of you may be thinking, okay, I've heard about that. How does it work? It can work, but it also cannot work. And there's a lot of nuances there. So just an FYI. To qualify for Medicaid, federal poverty guidelines for income and assets must be met. In addition, there are state requirements for Medicaid eligibility. More information about Medicaid is available from a local Medicaid office or Department of Social Services. Medicaid is essentially a safety net for those who didn't adequately plan for their financial needs in retirement or who encountered unexpectedly large expenses that depleted their financial resources. That's the key part. Unexpectedly large expenses. It doesn't have to be people who didn't have a plan. It doesn't have to be people who, just weren't able to cover themselves. It could just be, hey, we had some medical stuff happen that was unforeseen. It was a large expense. And, even with the best planning, we couldn't have afforded it. So it's a safety net, and I'm very glad it's there. While Medicaid recipients must have low incomes and few financial assets in order to qualify, their homes and cars are not included in determining Medicaid eligibility. Very important there. There is, however, a federal estate recovery law that requires each state to recoup assets from the estates of Medicaid recipients. As a result, children set to inherit the family home may find that instead the home must be sold and the proceeds used to pay for the care of their parents received. All right, that's sort of your, well, I don't know if that's a worst case scenario, because the worst case is you don't get the care you need, right? But it's something we want to avoid if that's important to the family. Hey, we don't want the house to be sucked up in these medical expenses. That's where we need to have the individual conversation. And really all the pieces that I've talked about already are huge parts of the puzzle in determining that. I'm going to go to the next page here and talk about long-term care insurance. All right, this is one of those things, and you could say this about all insurance. You're going to hate paying the premiums on long-term care insurance, but you're going to love getting the benefits if you get the benefits. And I know that's kind of true about all insurance, but I think it's especially true here. What does it do? Well, it gives you more control over your long-term care facility. Where do you want to live? This is a policy that will help pay to put you in the place you want to live. Protects your assets if long-term care is required. You don't have to deplete your retirement accounts if you need a higher level of care. You've got this insurance policy that'll pay out. It's purchased privately. The government does not have, as a Medicare program, long-term care insurance. This is through a private insurance company. And Medicare typically does not pay for long-term care. Again, there's a few circumstances where it could pay for maybe some of it. It's not a good thing to plan on. If you want insurance to cover long-term care, you got to buy long-term care insurance. And there are, by the way, a couple other things you can do with life insurance or this or that to help cover those costs. We can get into that at a later date, but this is kind of the bread and butter. So health insurance, Medicare don't pay for long-term care services in a nursing home or assisted living facility. The vehicle to prepare for that type of care is long-term care insurance. And Long-term care insurance also, as I mentioned, helps protect those assets. That's a big deal. Okay, I'll get into the little bit of details about Medicare here. Medicare will pay for a nursing home stay, but only if stringent conditions are met. Medicare will pay for up to 100 days in a skilled nursing facility, but only after a 3-day minimum inpatient hospital stay for a related illness or injury. Okay, so think about that. That narrows us down quite a bit already. Medicare will pay all the costs for the first 20 days, but you must, and this is of that 100 that I mentioned, but you must pay a co-payment amount for days 21 through 100 during each benefit period. Medicare doesn't cover long-term care or custodial care in a skilled nursing facility. The end result of all that, by the way, is that many people who need nursing home care are forced to spend down their assets in order to meet federal poverty guidelines and qualify for Medicaid. So let me game that out for you. The idea is you have a certain amount of assets, right? You don't have long-term care insurance, let's say, and something happens where you need long-term care in a skilled nursing facility. Well, Medicare may help out with that first part of it. But after those 100 days, assuming you even qualify for those 100 days, you are on the hook for the costs, right? And now we're spending down your retirement accounts. We're spending everything. And you have to spend everything in order to get to the level that qualifies you for Medicaid. So there's really no other option at that point. You are spending your assets to pay for your medical expenses, and then you're eventually going to be on Medicaid. And by the way, that is a perfectly legitimate strategy for some people. If we have the assets to self-insure, quote unquote, that's perfectly valid. But we need to determine whether we have that. We can't just hope and pray that we have that, right? For some people, they do. For other people, they need long-term care insurance because they don't have the assets to cover for an event like this. We go to the next page, talks about costs of long-term care insurance. So forget about the benefits for a second. What does the actual insurance cost me? Well, as you might have guessed, it's based on age, health, waiting period, level of benefits, term of benefits. Premiums do generally stay the same each year. That's a benefit. And it may, by the way, also be available from your employer. So if you're still working and you don't have long-term care insurance, I would definitely encourage you to check that out if it's available. So reading between the lines of those bullet points, generally speaking, the older you are when you buy a long-term care policy, the higher your premiums are going to be. And think about it from the insurance company's perspective. They're saying, well, the older you are, the closer you probably are to needing these benefits. Therefore, we're going to charge you more. That's where they're coming from. But where you're coming from is it may make sense to look at getting this when you're relatively younger. I'm not necessarily talking about age 20, although you could. But while you're still younger and healthier, that would be a great time to look into this because you're going to get as good of a rate as you can possibly get, and it's going to be generally locked in. And generally stay the same is not the same as always stay the same. Premiums can increase. There are a couple different ways it can happen. I'm not going to get into the details there. We can talk about that offline, but it does sometimes pay to get this done earlier rather than later. So just an FYI there. All right. Next page talks about I already alluded to this, personal savings. Another way, and I don't want to belittle this because this is a perfectly valid way, if you can swing it, to pay for your health care. And that is with the money you've already saved. There are people we've worked with who do not need long-term care insurance. They could afford it. They may get it anyway, but you may not need it. And the only way to know that, or to even have a reasonable guess at that, is for us to do a plan with you or really sit down and go through everything. By the way, we have a great planning service called the Good Life Plan, where we go through, take a look at all your assets. We can help tell you whether, okay, I think there's a need for insurance here, or, okay, here's what I would do for insurance, but you've got savings that can be used this way or that way and any way in between. I won't get into super detail there, but we really need to sit down and have a detailed conversation before I'm willing to sign off on this, because it can go south, as you might assume. If we deplete our personal savings, that means there's nothing to pass on, right? It means there's no extra money for doing things that, you know, you're on government benefits after those assets are depleted. So it's something we definitely want to consider. It's a perfectly viable option. I don't want to give the impression otherwise, but it's not going to be right for everybody. Insurance is going to be right for some people. This is going to be right for other people. So enough said on that. I think you get my point. Okay, we're almost done here. Next page is our summary. So I've gone through a bunch of things. Some of it probably review, some of it hopefully, you know, maybe added a little bit of clarity to a few topics. But what are the steps you need to take now to prepare for healthcare and retirement? That's the question you should all be asking yourself. And I don't care whether you are retired right now. What are the steps you need to be taking? That's what you should be asking yourself. Number one, research options for long-term care services. Not only, hey, do I favor a nursing home, an assisted living? Do I want to stay in my house for as long as I possibly can? But also, what are the costs? Hey, if you have a place that you know somebody who went into, for example, or you had a family member, what are the costs of that place? What are they expected to be maybe by the time you would need them? And then how do you pay for them? Right? And I skipped the second bullet point, went right to the third one. How do you pay is sort of in the background of all of this. That's where we can come in, by the way, and help you and say, well, if you went this route, this is how you would pay. If you went that route, that's how you would pay. We can develop a plan. Establish advanced directives. That can happen right now. And I would encourage you all. And if you need, you know, a great name of people who can help do that, please reach out to us. We're more than happy to refer you to some great legal minds here. But it's something we can do now, and it just saves anguish at the very least from our loved ones. Maybe everything would work out great without one, but why take the chance? Why, you know, leave that up to a loved one who maybe doesn't know what you wanted or isn't prepared to be able to make the decisions in the timely manner that you need them made? That's just something to take care of and get off your plate right now, in my opinion. All right, very last slide. Thank you so much for your attention. Again, I'm Anthony Gerby. We also have a couple other advisors, Eric Mullins and Jeff Stein, the founder and CEO, Jeff Stein, who many people ask if he's retired. He is not retired. He's still going strong with us. And we have a great team as well. You may have talked with Margie Goldfein in our office, and also Kim Hamlin, who is our new operations lead, doing a great job for us. So what happens next? You get in touch with us. And certainly if we work with you on a regular basis, we'll be talking to you about this. But if you have questions, if you'd like to talk more in depth about your strategy, whether you work with us right now or you're watching this video and you've never talked to us before, here's our contact information. Reach out. We are more than happy to talk this through with you. And if it makes sense to work together, great. And if you're doing great on your own, we'll tell you that too. So with that said, thank you so much for your time. And we'll see you in the next presentation a month from now. All right. Well,